Today we are going to discuss on an important topic called lifestyle factors which are affecting the immune system by an occupational therapy perspective. I myself am an occupational therapist. My name is Dr. Chaitanya Mantri. I am practicing as a consultant occupational therapist in Mumbai, India since 2007 and treating lots of patients in orthopedic, neurological, mental health condition in clinical hospital setup or home visits, and nowadays through online consultation as well. I am being associated with Live Love Laugh Foundation, which is being managed by Bollywood actress Deepika Padukone, which works with patients with major depression, schizophrenia, and suicidal tendencies as well. I'm conducting lots of workshops in different languages like Marathi, Hindi, and English in different areas, whether it is the rural or urban areas, in different setups in school, in community-based, and as well as in corporates as further. So we'll move to the main presentation. Now, the purpose of this presentation is to describe the relationship between lifestyle factors and immune system. We are very much aware about the term lifestyle. So the lifestyle term includes the way we eat, the way we sleep, the way we exercise, the way we move, the way we behave, the way we get engaged with others, including socialization. And at times, it is also related to drug abuses or substance abuses as well. So we are going to discuss this presentation with this perspective as an occupational therapist. So what is basically occupational therapy? Occupational therapy is a branch of rehabilitation which works in physical and mental health. Like a physiotherapist works in a physical condition, occupational therapist works with orthopedic, neurological, psychiatry, psychological condition, as well as plastic surgeons if required. So we see the patient with physical and mental condition per se. So what is the definition of the immune system? There are two types of immunity, that is innate immunity and adaptive immunity. The body's first line of defense consists of barriers like skin, mucous membrane, and cells like neutrophils and macrophages, which protect us from any kind of infection. Another form of immunity is adaptive immunity, which involves T cells and B cells, which can specifically target the pathogens and create memory for further immunity. This was seen during the COVID-19 times when the world was going through pandemic. And we were searching for different kind of antibodies to fight it in the future. Those who already had a history of COVID, these people had those memory of immunity with them. So in this case, T cells and B cells play a major role. Next slide. Now, as we have seen in the previous presentation about diet and nutrition, it plays a major role. A balanced diet is very much essential for a healthy immune system. This should include essential nutrients like vitamin A, C, D, E, minerals like zinc, iron, and it is very much essential to have omega-3 fatty acids in the diet. Impact of nutrition has a major role on our immune system. Reduced nutrient in the diet will affect immune system. So the less the nutrients, the immune system will suffer more, and we will be having a risk of early infections. Move to the next slide. So what is occupational therapy approach to all this treatment? Occupational therapy works through assessment, intervention, education, and environmental modification. What is assessment? As the previous presentation has mentioned about dietary pattern, different kind of diets and nutrition. Similarly, we have working here on dietary habits, nutritional needs of a person, and cultural factors. Different cultures have different way of having different nutrients in different timings of a year. So we will focus on dietary habits, the nutritional needs of a particular person, whether the person is having a sedentary lifestyle or a person is having a more heavy task in his day-to-day activities, and it should include the cultural factors. After assessment, detailed assessment of the client, we will go to the intervention part, which will be in collaboration with the dietitian and the nutritionist. Here, we create a personalized meal plans along with the dietitians, and we suggest them a healthy eating patterns. Now, in my country, India, we basically follow 3 patterns of meal. That is a breakfast, then there's a lunch, and then dinner. But we also have a timings for all this. Say, for example, the breakfast should be heavy and it should be like a king's meal. And it should be between 7:30 to 8:30 a.m. in the morning when the gastric juices are very active. The next meal will be the lunch, which will be around 12:30 to 1:30 p.m. in the afternoon. And it should be less in quantity. And the last part of the meal will be in the evening, that is 6:30 to 8:30, around 3 hours before going to bed, at least. And this should be the lightest meal. We regard this as a breakfast should be like a king, the lunch should be like a common man, and the dinner should be like a poor fellow. So our diet should be lesser in the dinner and more in the breakfast. So this kind of a dietary pattern, considering patients' other factors like the diagnosis, any previous history of any other condition, that has to be tailor-made to the patients. The next part should be education. We have to teach the client about the balanced diet, provide meal planning resources through different leaflets, through different websites, through apps, or any other sources, like, say, for example, lectures which we have conducted today. We should encourage whole foods and vegetables. We should encourage the importance of vegetables in our diet, the use of fibers in the diet, and we should help to advocate it within the community. And the last part would be environmental modification, which will promote regular meal scheduling, considering their work patterns, reduce access to the junk foods as it contains lots of salts and which can add to added difficulties, say, for example, hypertension, or those with a risk of cardiac conditions. These things can give a negative effect. Along with that, we have to create a supportive kitchen environment. Our kitchen environment should be such that it should help in creating an environment for a proper nutrition. Next slide. Now, the second most important part is the physical exercise and activity. Now, consider a person who is having a sedentary lifestyle, like those working in IT sector, or those who are having an office job. In these people, their more activity is in a sitting position. So we should encourage them for a walk. We should encourage them for a resistive activity. We should encourage them for aerobic activities. Okay, this will help in preventing obesity-related difficulties. So what we can do, we can tell them to take a brisk walk after 40. Yes. So we can tell them to go for a brisk walk after 45 minutes of their activity. We can keep some kind of a modification in offices whereby there are cycles. There is steps available for stepping exercise, or some kind of a therabands or weighted cuffs, which can help in providing them with the resistive exercise. So this will help in strengthening their stability, improve their posture, and overall help in reducing the obesity. The next slide. Now, what will the occupational therapy approach work on? Occupational therapy approach will be, in this case, again through assessment, intervention, education, and environmental modification. What is assessment? We have to evaluate the client's current level of activity and identify the barriers to the exercises. Say, for example, if a person is doing heavy work, we would encourage him some kind of relaxation activities. Okay, like we can ask him to go for a yoga session. If a person is doing a sedentary work style, we can encourage him for a walking pattern, or cycling can be encouraged. Different intervention like developing a personalized exercise routine, which are tailored to the patient's needs and wants and according to the person's age, is essential. And third part would be education. We have to teach the client about importance of regular exercise for better immune health, which will provide him information of safe exercise practices and again injury prevention. This would involve work simplification and energy conservative techniques. And the last part will be environmental modification. We have to recommend adjustment to client's environment to promote physical activity, example, standing desk, home exercise equipments, and other devices. Next slide. The third important part in the lifestyle is sleep and rest. A sound sleep will give you a good immunity. So we should have a good amount of 7 to 8 hours of a nice rest or sleep just after we complete our work. This can include added small naps in the afternoon after you have a meal. In India, we call it Vama Kukshi. Vama is left, so rest on your left side of the body for at least 15 minutes after you have your lunch. So this helps in better digestion, relaxation of body. So altogether, we can have a 7 to 8 hours of a sound sleep in a day, which would include a 15 minutes of a small nap in the afternoon. Sleep deprivation reduces the production of cytokines and affects the T cell functions of the immune system, increasing the person to vulnerability to infection. The impact of sleep disorder on immune health would be more if a person will have history of sleep apnea and insomnia. So we'll move to the next slide. So what is occupational therapist approach? Occupational therapists work through, again, assessment, intervention, education, and collaborative care. So in assessment, we need to assess the sleeping pattern of a person. Now there are different kind of devices available with us, whereby we can come to know exactly whether the person is having a sound sleep or not. We can connect these devices to our mobile phones, and we can come to know the exact sleeping pattern of it. So this kind of a objective assessment will definitely help us to know the pattern of the sleep, and we can make some changes with it. So we can also assess whether there's a loud noise where he is sleeping. The texture of his mattress can affect the sleep. The stressors or psychological stresses through which the person is going can affect the sleep. And at times, the light arrangement within the home environment can affect the sleep. So this kind of assessment has to be there. Then we will go to the intervention part. We have to develop a strategies to improve a good sleep hygiene. This would include consistent sleep schedules, relaxing bedtime routines, and sleep-friendly environments. Now, what we can do for a sleep-friendly environment, we can keep a light music, which would help in relaxation of the sleep. There are different kind of apps which help us to understand the sleep pattern of a person, and accordingly, we can change our pattern. We can tell the person to go to our sleep early in the early at night. So this can initiate it better. There are the different kinds of medications available, which will help in initiating the sleep easily. So we can take help of these kind of things for better sleep pattern. We can educate the person that we should switch off all our mobile phones, all the televisions, all the screens, at least 1 hour prior to going to the sleep. This will help in initiating the sleep easily and reduce the stress on our eyes. Okay, we should avoid use of mobile phones or laptops on our bed. The more we follow these kind of a sleep hygiene, the better would be the sleep and better would be the quality of living. We should educate the client about the importance of sleep for immune health. The better the sleep, the good you have a immune health. So we have to focus on encouraging people for early bed and early to get up in the morning. So this kind of a healthy pattern will maintain our immunity. We should collaborate with other kind of sleep specialists, like those psychiatrists working in this condition, or healthcare professions working in sleep-related disturbances. The next slide. Now, the fourth important part of lifestyle is the stress and mental health. Stress has a bigger role in all the aspects of our life. It might be a work stress, relationship related stress. It can be stress with our neighbors. It can be stress with our children's, their way of behavior. It can be stress related to anything. It can be related to our financial conditions. We had suffered a huge stress during the COVID-19 times, when it was not just a physical stress, it was health related stress, it was financial stress, and in overall, it was affecting us every day. So chronic stress will lead to increased cortisol levels, which we will call bad hormones of the body, and which can suppress our immune function and increase inflammation. We will not feel easy. We will have joint pains. We will find it difficult to think at times. And this will affect our overall confidence and quality of living. Stress is again associated with higher risk of immune-related disorders such as autoimmune disease and chronic infections or recurrent infections. Next slide. Occupational therapy approach in this condition is again through assessment of the cause of the stress, whether it is within the family responsibilities, whether it is at work-related responsibilities, or whether it is because of some other health concerns. The more the stress a person has, whether it is a physical or mental stress, it directly affects the cells of the body. Our cells get stressed, and because of that, their functions get affected. So we have to assess where exactly the stresses are coming. Then we have to move to the intervention part, which will include stress management techniques, as mentioned before, such as mindfulness, deep breathing exercises, pranayama, yoga, and guided relaxation techniques. Breathing directly affects the way we think. So in yoga and breathing exercises, we focus more on the way of we breathe, how much air we inhale while we breathe, and how we relax. There are different kind of relaxation techniques like the shavasana in yoga, which help a person to completely desensitize from the external world. Even in modern times, techniques like Reiki are being practiced, and this help in initiating relaxation of the body, reducing the stress, and improving the sleep pattern as well. Reiki is being practiced nowadays in different hospital setups, along with that clinical setup as well. The more details about Reiki, which is again a Japanese technique, is available through different resources. You can Google it out later, and you can learn it for the betterment of your health. Then the third part is education. We have to teach people one more important thing, that it is not we who can do everything. So we have to understand first our limitations. We have to understand our opportunities and the areas from where we basically can help these people. Say, for example, we can provide them with different resource materials. Like, say, for example, use of meditation apps are nowadays available. Support groups are there. We can make use of a social networking. It can be one-to-one person. It can be in a community. It can be a kind of a small activity which will involve, say, for example, trekking, hiking, whereby we meet together, we talk with each other, we do a particular task in a stipulated timing. So this can give a kind of reduction in stress as well as encouragement in our quality of living. Then occupational engagement, encourage participation in meaningful activities and hobbies, like, say, for example, going for a walk together, reducing stress, having a walking meetings. So instead of having a meeting in a sitting position for long hours, we can prevent these kind of physical problems for prolonged sittings, reduce those stressors. We can create a happy environment in offices, in school, in home environment, which will help reducing the stress. And the most important thing, we can laugh. Laughter helps in improving our immune system and reducing the stress. So nowadays, different kind of laughter clubs are there in different gardens or different communities, just to encourage reducing the stresses. We can have a common goal like reading a book, reading poems, reading any kind of important information in front of a community. This will help in creating a bonding, which again reduces the stress and facilitate involvement in social and recreational activities like gardening, playing, or any kind of a competition would definitely help. So next slide. Social connections and relationships, and again social support, which will help in immune health. The more a lonelier person is, the more affected his immunity. That's why in many communities and different countries, it is said that if you are married, you are more happy. Or if you are in a relationship, or if you share your thoughts with any other person, or you have any kind of social support, your immune health would be better. So strong social connections are associated with improved immune health, and that would help in reduction of stress-related immune suppressions. Social isolation and loneliness will reduce your confidence and increase the stress and decrease your immune function. You will lose your confidence, your ability. I've seen many graduates and postgraduates. They are very good in their education, but when it comes to presentation, they lose their confidence. That's because at times they are disassociated, or they are disconnected from their social networks and connections. They have reduced their expression within the community, and that's where it affects and increase the anxiety. What is occupational therapy? Next slide. What is occupational therapy approach in getting this social connection back? First is assessment. We have to determine the client's level of social engagement, whether the client is comfortable through online sources, like say for social media, any kind of online lectures like we are conducting right now, or whether the person is comfortable enough in a community, in a one-to-one gatherings. So we have determined the client's level of social engagement and identify the barriers to social interaction. Like say, for example, whether the person has communication-led difficulty, any kind of anxiety, like social anxiety, difficulty in transportation if a person is having physical disability, or any other difficulties in the way of communication, whether it is in written or oral form. Then intervention will include encourage the participation in community activities like a group activity or Sunday activities or Saturday evening activities, or it can be a singing competition, or it can be a competition or a games which we play, just to have a kind of a socialization. So this kind of intervention techniques can be made use of. We can facilitate social connections by organizing different camps, providing resources in local newspapers or magazines or through blogs or apps. Use of education as a tool. We can teach clients about the benefits of social connection to help in improving the health. The same education has to be provided from the schools to a college or university level. And last would be environmental modification. We have to suggest changes to clients' environment to promote social engagement, like creating a welcoming space for visitors, setting up virtual communication tools or virtual communication boards, or any other method which will help in improving communication. Communication can be oral, communication can be written. There's some who are better in chatting on a mobile app, but they find it very difficult if they see the same person in front of them. So we have to change the pattern. We have to change the working environment to help in encouraging the social connections. Next slide. The fifth most important thing is the substance use and exposure to toxins. Smoking and alcohol consumption is injurious to health. Okay, so smoking increases the risk of respiratory infections. The person who smokes, he gets the infection. Along with that, the person who who is normally we call the passive smokers, they also get affected because of that, and that affects their white blood cells. When your lungs are affected, less you breathe in, or less your alveoli will function, and that will reduce the overall oxygen carrying capacity of your cells. So that we have to reduce. I would not say it is not possible to completely disconnect from smoking. If it is, then it would be better. But smoking has to be reduced to help our breathing function and prevent respiratory infections. Then the second part is alcohol consumption. Alcohol has excessive alcohol consumption has directly linked to the liver damage. So, and which will help in increasing susceptibility to infection. So we should have a check on this smoking and alcohol consumption. I myself, previous slide, please. I myself have conducted different de-addiction camps for alcohol de-addiction and tobacco de-addiction in different areas, whereby this different employees of a particular institution. We have a Mahananda Dairy in Mumbai, where there are 1,200 employees of different hierarchy, like there are workers and there are officers or administrative. All these people were affected because of substance use of alcohol and smoking, which affected their quality of work, and finally it affected the profit of that institution. So they called me to conduct different kind of camps, to do one-to-one workshop or one-to-one sessions with these kind of clients, and to help them completely go away from this habit and to improve the quality of living, because these people cannot be suddenly replaced with a new batch of employees. So we had to go for a different kind of a de-addiction work. I have done a lot of work in by written means, like through magazines, through articles, in this case of de-addiction. Next slide, please. So occupational therapy approach would involve assessment and identifying the pattern of substance use and exposure to these toxins, discuss the risk associated with smoking and alcohol consumption. Alcohol not only affects your liver, but it also affects your thinking pattern. At times, because of excessive alcohol consumption, it leads to change of behavioral patterns, that a person becomes more aggressive. At times, hitting and biting behavior increases, and it finally affects his social, personal life, family life, and social life. Intervention would involve provide support for smoking cessation and alcohol reduction, collaborate with addiction specialists. These are normally those who are psychiatrists who are working in alcohol de-addictions, and recommend resources for cessation of programs. Education, inform clients about the impact of substance use on immune health, offer alternatives for managing stress and anxiety without restoring to harmful substances. And last part is environmental modification. This would include suggest changes to the client's environment to reduce the exposure to toxins and discourage substance use. Example, smoke-free homes, avoiding environment where substance use is common, educating the family, educating the people in the workspace, educating the community, and help promoting the de-addiction and effects of smoking and alcohol consumption in theaters, through radios, through social media, and other means. Next part. Now, the conclusion, the main takeaways about lifestyle factors we are going to discuss. What is the role of occupational therapy in the entire process? And what is the occupational therapy action plan? We'll move to the next slide. So the main takeaway about lifestyle factors for immune health is, first thing, nutrition has a major role. Physical activity is necessary. Sleep and rest is essential. We have to reduce the stress for better mental health. A good social connections is important, and substance use should be managed properly. So we'll move to the next slide. So the occupational therapy's role in this lifestyle changes would be encourage a holistic approach in identifying and addressing the lifestyle factors which are affecting the immune health. We have to focus on personalized or client-centered uh, plan to help help in clients' unique needs and preferences. We have to collaborate with other healthcare professionals. This would include the physicians, the dietitians, the nurse practitioners if they are involved, social workers, and psychiatrists if required. If a person requires rehabilitation, we have to work on his rehabilitation, which would include physical and mental rehabilitation. Next slide. Now, the occupational therapy action plan has to be holistic. We have to talk with the nutritionist, the dietitians, the psychiatrist, and we have to have an interdisciplinary collaboration to help in implementing this plan. Education, empowerment, and advocacy has to be done at the level of a small village, district, city, country, and internationally. So education and advocacy has to be done through written, oral form, or through social medias. Promoting healthy habits like healthy nutrition, good sleeping pattern, good exercise pattern. We have to promote why we should be away from the substance use, its importance within the community. And the last slide will give you information about my contact details and the website, which will focus on Care and Cure Clinic, which I had started since 2009, which helps in promoting health in physical and mental conditions. Anytime if you have any difficulties, you can just go through my mobile phone. The same mobile phone is available on WhatsApp and Telegram also. Along with that, I will always happy to respond to your communication through email. And you can go through different videos and links through my website for the more information on resources.